So either of you can feel free to tell me a little bit about what brought you to see us, a little bit about how that process went for you, and share a little bit with the perspective of other people wondering, how was this for you?
We were referred to by our Dr. Pfister, and I needed some serious dental work and a lot of implants. I believe I've had about 9 from you, and 3 surgeries I had from you. All went very well. I had very little to no pain, which was one of my main concerns. The thing I think I liked best was that you always answered my questions. If I had any concerns, however silly they may be, you were always, you and your staff were always there to answer any questions that I had, any concerns that I had. You were always professional, and that's something that's not always done nowadays, that we've experienced anyway, I believe.
Yeah, and I think the staff is very professional. They kept me informed of what was going on between you and her when she was in surgery. You made sure her meds were available for her, and she's a scaredy cat when it comes to dentists, and she's very comfortable coming to your office now, Doctor.
So most people have challenges with the dentist, and it's always nice to hear the story where we've actually taken someone who has a lot of trepidation and fear from some bad experience maybe in the past, and now feels like this was not that big a deal.
That's actually the truth. I used to have to take a tranquilizer before I would even walk into a dentist's office. And that's the absolute truth. I was so frightened. That's probably part of why my teeth went bad, because it was, unless it was a dire emergency, I wouldn't go. But you guys have always made me feel comfortable, and again, it was the pain I was the most afraid of. And my outcome is fantastic. I'm very happy with it. It's been a long time. I believe I started about 2.5 years ago with you, and I've finally got something I can chew with right now.
Now, your happiness, I have to tell you, is the ultimate reward and justification for us, no doubt about it. That's why we're here. I mean, I have to say that's what makes not just my job, but our entire team's job just rewarding. You know, it's really rare that we have the other perspective of like another family member here, you know, because you, Mr. Fitzpatrick, have to go through it with your wife. So, from your perspective, how was that, watching your wife go through this?
I was worried about her, but she came through okay. Like I say, your staff kept me informed the whole time. She was very happy with you. You can't believe how many people she's told about.
Well, that's good.
And her experience here.
Yeah.
It's
How about, because I'm very passionate, and so is our entire team, about how we communicate in an interdisciplinary fashion with your dentist, because at the end of the day you see us, but you also see your dentist, and most people may or may not understand that implants have 2 basic phases, right? One where we do surgery to put the implants in, and one where you put the teeth on the implants done by your dentist. And that takes a lot of very close communication. In fact, in your case, you had braces, you had surgery, and you had the teeth. So it took a lot of communication from our team. Our team consists of Dr. Pfister and Dr. Gray as your orthodontist, and Dr. Pfister, your restoring dentist. Tell me about that experience, because that gets quite confusing sometimes.
I think that's very interesting. In fact, it was kind of nice to go to one, and they were already informed on what the other was doing already. I didn't have to, because sometimes there was, in my case, there was so much to be done that at times it got confusing. Not particularly for me, but it was just a lot to be done and to remember it all. But each dentist, the orthodontist, Dr. Gray and Dr. Pfister and yourself, were always on top of it. It was kind of funny because I'd go in to see Dr. Pfister and say, okay, I just saw Dr. Gilbert. They go, oh yeah, we know already. So it was like you guys were on top of it. It wasn't just talk. You guys did carry through, and it was nice to know that you had that team working for you.
No question. I mean, you had what we would consider a complex case, you know, what we call a full mouth reconstruction, and that definitely does not occur with one person operating on their own. And so it really matters to have a great team like we had. And for us, the ultimate perspective is that it went smoothly for you, where you felt there were no glitches, or you felt like everyone was on top of their game.
Exactly.
Now that you've had your teeth for a while, how are they?
They're great. I mean, I think I told you, I said I was looking forward to corn on the cob, as I referred to in the card that I sent you. And that was really you'd be surprised when you don't have the ability to bite into something or to chew on something. People that have their teeth, young people in particular that don't have to worry about that, don't know what it's like to have to struggle. Because at one point I had no back teeth, so I had to eat like a chipmunk, hence the card. Then at one point I had back teeth, but I had problems with my front teeth. So I had one tooth on the bottom that was being used for the anchor for the braces. So I could chew on one tooth on the bottom. I had teeth on top, but that's technically one tooth to try to chew. When there were braces, then that was another thing. So you're learning to eat differently each time something is done. And so it was an experience, but like I said, I felt like I was in good hands. That I was told, don't eat this, don't eat that, so that I wouldn't break things, or like particularly the braces. I was a little bit of a baby with the braces, I have to say. But the rest of it was really not that. The waiting was the hardest. I'm not the most patient of people, but I understood it because you explained it. That's the whole thing.
I have to commend you. Not many people, particularly mature individuals, take their life by the reins, if you will, and say, I'm going to fix my teeth and do what it takes to get there. And it takes a lot to do that, and that was a big commitment on your part, and
Yeah.
it's remarkable and commendable, and it's like I said, it's so rewarding for us to see you go through that process with a successful result. What would you like to say to patients out there who may be in your position like you were years ago?
Well, I don't know if you're referring to my fear and or the teeth themselves, but for one thing, the fear. In fact, I remember telling a young boy out in your office, he was worried about the shots that he was going to get, and I told him, even your shots don't hurt. You do something little magic on there that you put on there and don't even feel the shot. So for a person that's fearful of pain, don't be. I mean, I was the biggest scaredy cat out there. So the other thing is if you think you can get along, for older people that think you can just get along, I really say get your teeth fixed, because it's so rewarding to have it done. I know some people might want the dentures, but I'm so happy that I got the implants, because there is a difference in taste. People don't realize the roof of your mouth is a place where you taste food.
Yep.
Some of the flippers and stuff I had showed me that.
Mm-hmm.
So it made me very happy that I planned to go ahead with this and do it. But again, you and your staff, like I said, the big thing too for me was you always answered the questions. To you, it's an everyday thing, but to someone like myself or other patients, it's not. So it's important to have someone that doesn't get upset when you ask probably a silly question. You answered it politely, like I said, and I've had the opposite in the past as well.
Yeah.
So that also gives me trust. When somebody won't answer, it's go, why aren't they answering? And you never did that. You always came out, and all of you, and answered my questions, what I needed.
Well, you've definitely become a part of our family.
Oh.
You and your husband, and I have to tell you that on behalf of my entire team, the whole Inland Institute, Dr. Gilbert and his entire team, you will always be family.
Oh,
so we want to obviously extend an open invitation to you at any time to visit, as we would for any of our patients, because we're committed to you and your health for the long term.
Oh,
And
thank you.
if there's anything we can do to help, please let me know.
Will do.
Thanks for this opportunity.
Thank you, Dr. Gilbert.
Take care.